Hello everyone, are you planning to get pregnant this 2025? Here are the steps you need to take in order to get pregnant this 2025. A lot of people have been getting to me and they want to get pregnant. What do you have to do? What do I have to do to get pregnant? So today's video, we're going to be taking you through 6 steps that you have to take in order to get pregnant. What are the 6 steps? And each step you need to complete the previous step before going to the next step. And especially the last step, you can't do it without completing the 5th step. This is your favorite doctor, Dr. Noella, and I am back. We had to go through into the communities to get them information to others in the community. And we are back for you. This is Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women related health issues. I don't think you want to miss out on these videos or our upcoming videos. So make sure you subscribe to this video. So let's dive right into the 6 steps. Welcome back to Talk Pregnancy with Dr. Noella. These are the 6 steps. We're going to begin with the first, getting pregnant in 2025. Now, what is the first thing you need to do? You are sitting and you want to get pregnant next year. What is the first thing you have to do? Now, you need to know what pregnancy is all about. Before pregnancy wants to occur, what happens? This is the uterus. This is what we call like the womb. This is the womb. And this is the vagina here. We have the cervix here. So this is the womb. This is the womb. This is the cervix. So before pregnancy has to occur, what happens? We have the sperms, which is released from healthy sperms from the male, which is released during ejaculation, and then it gets into the vagina and up. Here we have, this is the ovaries. These are the ovaries here. These are the ovaries. We have the ovaries here. Now, what happens before you get pregnant? These sperms, which are released after ejaculation, it gets into the vagina, passes through the cervix. Here, we should make the cervix a little bit open. It gets into the cervix and it swims up. This is the sperm swimming up. Let's take that, it goes to the right. And when it is going into the fallopian tube, here, if it comes, this sperm has to come and meet what? An egg which has ovulated. This is an egg which has ovulated and burst and enter, and it's in the fallopian tube. So when this sperm comes in, it meets this egg and fertilization occurs here. It occurs in the fallopian tube inside here. It occurs inside here. This is the how pregnancy occurs. So if there is a breach in any of these things, maybe if the man has a low sperm count, then maybe sperms will not be produced. If the woman has maybe an infection which causes a blockage in the fallopian tube, the sperm is not going to meet with the egg. So if you have anything that disrupts this process, therefore pregnancy cannot occur. And especially if the sperm is not good, if the egg too is not good, pregnancy might occur, but maybe the baby might have some malformation leading to things like chromosomal abnormalities. So the first thing, now we have known what pregnancy is and how pregnancy occurs. What is the first thing you need to do? Now, as we take this off, we say the first thing to do, pregnancy 2025. What do you have to do? The first step. What is the first step? Prepare for pregnancy. So if you have to get pregnant next year, it means you need to prepare for it. And preparation is 3 months before you take in, and at least 1 month before you take in. That is a period where they call pre-conception care, where a lot of things can be done, where You have to prepare your body for pregnancy. It's very important. This is the period of preconception care. That's what you and the man have to do before you get pregnant. So the first thing is preparation. Preparation for pregnancy. The second, what is the second? Because you have to prepare for pregnancy before you get pregnant. Now, what is the second thing? What is your present state of health? Either you and your spouse. Now, your health status. Your health status. What is your health status? Because it's not only you, it's also with the man. Now, do you have any medical condition that is going to affect pregnancy? Do you have maybe hypertension? Do you have diabetes? Do you have sickle cell? Are you epileptic? Many other conditions. If you have any of these, if you don't know, and even your partner, does he have even sexually transmitted infections like HIV, hepatitis B and C, chlamydia, gonorrhea? So do you have any of these? And if you don't know, what should you do? Therefore, visit the hospital and do the test to ensure that you know your health condition. Now, there are some certain things like sickle cell disease where you have to test your HB electrophoresis to know if you have the gene for the sickle cell or not. This can be done maybe before you're getting married. For those who are married, it could be done before you're getting married. And once you've done that, definitely you see that you're already compatible, then you might not have any issues with that. But when in each pregnancy, you must check your health status, because at today you might not be hypertensive, but it does not guarantee that in the next 1 month, 2 months, or 3 months, you cannot be hypertensive or diabetic. Therefore, at each pregnancy, you have to check for these medical conditions. Now, what is the third step? We are gradually getting, if you have not subscribed to this channel, please click on that subscription button, because you're going to be learning, getting more educative videos on this step by step, so that you understand well. Now, what is the next? Are you on any medications? Are you taking any medications? If you have a medical condition, for example, if you're hypertensive, you're diabetic, are you taking any are you taking any medications? What medications do you take? So we are on medications, because there are some medications that when you take them, it can hamper the baby's growth. It can cause malformations to the baby. Therefore, you need to stop taking these medications for a period of time before you get pregnant, because if you take these medications when you're pregnant, it can destroy the baby or cause this. Therefore, you have to wait for a period of time so that you stop this medication and it is being excreted out before you actually take it. There are some medications like people who have sickle cell disease. Of course, they also have their rights to their sexual and reproductive health. Therefore, they also have to get pregnant. There are some medications that they take like hydroxyurea that they're not supposed to take if you're hypertensive too. There are some medications you're not supposed to take during pregnancy. You have to change these medications. How do you do it? It is your health personnel who has to do that. So if you're planning to get pregnant and you have this medical condition, ensure you go early. The pregnancy should not shock you. Please, it should not shock you. You get to the health personnel and you tell him, I have this medical condition and I plan in getting pregnant in the next 2 months or 3 months. What should I do? That's when they're going to switch. They see the medication. If it's compatible with pregnancy, you continue. If it's not, then you're being switched to the one which is compatible and okay with pregnancy. What medication should you take? And now you need to be very, what medications are you on? Now the fourth is, what should you take? It's very, very important. That's where we come in with folic acid. Now, folic acid is something that you need to take every day, 1 tablet every day till you get pregnant, at least 1 month. Most of the times it's advisable to start taking from 3 months. And now it might be some women who have had some other medical conditions. These doses are going to be increased in these women. Also, you can add this folic acid. You can combine it with other vitamins. There are some medications that already have the combinations of all these vitamins, like vitamin D, vitamin C, which are all healthy for the growth of the baby. Now, this folic acid, why is it important? Because it's very important in brain and spinal cord development. You see children who are born with their brains not well formed, their spinal cord not completely formed, is because of the lack of folic acid. Sometimes it even helps you in the development of the heart. And if you're not taking this folic acid, it can increase your chances of having children born with malformations. Therefore, it's important that you take folic acid at least one tablet daily till you get pregnant. And once you get pregnant, you still continue, because that is the period um when the baby's organs are being developed. And most of the time, by the time you are discovering that you are pregnant, these organs have already, most of these organs, like the brain and the spinal cord, have already been formed. So if you missed out on this section, even you increase as many doses of folic acid after the brain and spinal cord has already been formed, if there was a malformation there, it wouldn't change. Please take note of this. If you want to get pregnant, ensure that you visit your doctor to verify for all this before you're getting pregnant. Now, the fit. It's also important, what other things should you take apart from the folic acid or vitamins? Eat enough fruits and take enough vegetables. And depending now on your weight, you have to measure your weight. Are you obese? Are you overweight? If it's that, you have to do exercises to come back to a normal weight before you take in. So you do exercises at least 3 to 4 times in a week, lasting for about 30 minutes. Those are the recommendations. Now, what is the fit point? The fit point is very, very important, because you cannot go to the sit point without having accomplished the fit point. The fit point is your fertile days. So whatever thing you do here and you don't reach your fertile days, you have intercourse not in your fertile days, you cannot get pregnant. And how do you calculate your fertile days? I made a complete video on that. So after this, please don't hesitate to go after and watch this complete video, simplified method of calculating your menstrual cycle, to know the fertile days and to know when you and your ovulation day. This is very important. So because if you do it after or before, you won't get pregnant. Please, now, once you know your fertile days and you have intercourse during your fertile days and you get pregnant, what is the next thing to do? Now, the next thing is a pregnancy test. That is the next and the last step, a pregnancy test. When should you do the pregnancy test? If you've already calculated your fertile period for this month and you see that, okay, it is this time and you had intercourse during that time, at least 2 weeks after that, you should be expecting to get your next menses. And if the menses does not come, what is the next thing you do? A pregnancy test. And we're hoping that everything that you've learned here, and these are the steps you can take, at least 2 to 3 months, 3 months to prepare yourself and carry out all these things before you get pregnant, before thinking of your fertile days and doing the pregnancy test. So I wish you all the best coming 2025. If you have any comments, don't forget to drop it on the comment section. We're going to answer you. And if you want a private consultation, if you want to meet with me directly, if you want to book for a consultation, then you can click on the link below. It will take you to our online consultation platform where you're going to follow the modalities in order to reach out, so we can have a 30-minute one-on-one consultation with you to help you follow up your pregnancy or clarify you on any specific thing. And if you're yet to subscribe, don't forget, click on that subscription button and also the notification button, so that you're going to see our videos whenever it is out. Goodbye and God bless you all.